Namaste, myself Name-Shivi Saxena, faculty of Physiotherapy and Diagnostics, and my discipline is Medical Laboratory Technology from Jayoti Vidyapeeth Women's University, Jaipur. Welcome in digital version 2.0. So today my topic is tinea solium. So let's start my topic. Firstly, uh, firstly common feature of class Cystula. So adult worm is flattered, ribbon-like without body cavity. The body is composed of a head, neck, and segmented strobulus. The head has suckers, rostrum, and hooklets or sucking groups. The neck is the budding zone from which segments are formed. The strobulus consists of immature, mature, and pregnant proglotides. They are hermaphroditic. There is a set of female and male reproductive organs in every mature prolonged. Digestive tract is absent. Nutrition is absorbed by villi of body surface. They are biohelminths. Intermediate hosts are indispensable. And basics complex to a host life cycle, and human beings are the only definitive host. Small intestine 2 to 4 meter long and 800 to 1000 segments. Both humans and pigs can act as intermediate hosts. Larvae and cystitis. Most common in Latin Africa, America, and India. So 40,000 people have symptomatic neurocysticercosis in Latin America. So uh, tapeworm uh, introduce cystodes. So they are flat in cross section and hemiphagocytic and live in the intestine with fecal. Life cycles are complex and can include multiple intermediate hosts. No mouth, no digestive system. They have suckers and teeth that grab the host and reproductive structure behind the short neck are repeated part of the womb, each containing reproductive structure with eggs and sperm, which can be released with the host feces. The piece gives the worm a ribbon-like structure, so beneficially for absorbing nutrient from the intestine. So, so the body plane and of adult cystodes include a scolex, look like the head, a neck, um, vitaminate, so structures this on screen. So this structure. So uh, include a scolex look like the head, a neck, and strobila that can extend for only a few progloids or thousands. The strobila is not really metameric through as several organs like the excretory system extend through the entire bone and prolongate is individual segments. Most worms are very long, occupying the entire length of small intestine. Okay. So morphology. Adult is flattened, ribbon-like, creamy, light in color, measures about 2 to 4 meter and has 700 to 1000 proglytes. So it consists of three parts, so scolex, second neck, and third strobila. So Scolex is global, 1 mm with 4 suckers and 1 rostrum and 25 to 50 hooklets arranged in a double crown. And neck. It is the narrowest part of the body and budding zone containing germinative tissue and strobila. So immature prologates and mature prolate and gravid prolates. So immature prolates are transverse rectangle located in the entire part of the body and inner organs are developing. Second, mature progloids, so are square in shape and located in the mid part of the body and have 150 to 200 tests, a centrally straight uterus and 3 lobes of ovary. And third, uh, pregnant or gravid progloids, so are longitudinal rectangle located in the posterior part of the body and contain a branched uterus filled with eggs. The number of main branch of each side of the uterus stem is 7 to 30. So, and so developmental stage, the egg. So, firstly, egg converted larval stage, and then adult form, and last eggs. So with very few expansion, where vertebrates are the final host. Harboring the adult tapeworm and many invertebrates and vertebrates are parasites as intermediate host. The embryonic egg contain the oncosphere, a larva that will penetrate the intestinal wall after egg and swallowed by intermediate host. The oncospores are Ecusoda have 3 pairs of hook which make it easy to identify them. The egg of the pseudophilidin tapeworm has a thin cell wall and the operculum, which on hatching open to release the free-swimming larva. In contrast, the egg of the cyclophilidins tapeworm has a very thick, so resistant eggshell with no operculum. The egg of Seasonata or Solium are similar. Okay, so the egg of Seasonata are indistinguishable morphological. The egg are spherical, diameter 31 to 43 mm, with a thick, redly striated brown embryo core. Inside each an oncosphere with 6 hooklets. And Cystitis cellulose. It is a semi-transparent and elliptic bladder like a white pomegranate seed about 0.6 to 1 centimeter. There is fluid and a white scolex with 4 suckers and hooklets in the bladder. So life cycle um, with an so this life cycle is okay. So life cycle is this. So final host is man, and intermediate host pig or man. And infective stage cysticercus and egg. Infective mode eating raw bean pod. Site of habitation, so adult in small intestine and cysticercus in tissues. Infective mode of cysticercosis, so endogenous, exogenous, autoinfection and foreign sources. Lifespan more than 25 years, so cysticercus can survive 5 to 6 years in human body. Okay. So human infection tenacious, so the scolex attached to the mucosa and being forming segments. After two mouths of infection, segments being to form the distal and excreted in the fecus. Each segment contains 60,000 eggs, and worm causes only minor inflammation to the intestine. That mild symptoms, abdominal pain, distension, diarrhea, and nausea, are none at all. Okay, and human infection, cysticercosis, so fecal oral contamination with sodium eggs from tapeworm carries. An internal auto-infection is also possible. The invasive oncosphere in the eggs are liberated by the action of gastric acid and cross the bowel wall. Remember, cysticerci are too big to cross the bowel wall. They establish at small terminal vessels, brain, muscles, and eye, where they grow to about the size of 1 centimeter in 2 to 3 months. Or is muscles small and palpable, movable nodules, chest and arms, so mild or no symptoms. Ophthalmic cysticercosis, so intraocular cysts floating freely in the vitreous humor decreased visual acuity. And neurocysticercosis, so most symptoms are because of the inflammatory reaction associated with cyst degeneration that may take a year to happen. And hydrocephalus and encephalitis and meningitis. So um, so this and clinical manifestation. So symptoms can be different. So depending on where infection with cysticercosis occurs, how many cysts are there. So most cases are asymptomatic, and incubation months or 5 years. Okay, so subcutaneous time, that the subcutaneous nodules are usually found in head, limbs, neck, abdomen, and back. They are movable and painful, painless, sorry. And brain type neurocysticercosis. So the symptoms are related to the site of infection. The parasite may manifest headache, nausea, vomiting, paralysis, weakness in limbs, and diplopia, dyslim, mental disorder, and the most frequent system of the brain cysticercosis. So, brain cysticercosis or neurocysticercosis. Okay, so diagnosis of tinea sessionata infection. So, firstly, teniasis. So, confirmative diagnosis of teniasis is made by finding segments or egg in stool. So, first, direct fecal smell. Second, brain flotation test. Third, cellophane tape technique. And second, cysticercosis. So, biopsy of subcutaneous nodules, so X-ray, CT, or MRI are used for the diagnosis of brain type, and ophthalmoscope examination is used for ocular form. Immune and third immunological tests are for reference only. So, diagnosis tinnitus, so visualization of tinea as was the only diagnosis until recently, has poor sensitivity and difficult to differentiate from tinea seasonata. And best diagnosis, so come corporation detection ELISA that will detect DNA specific molecule in the fecal. So 95% sensitivity and 99% specificity. And option not efficient and cheap test versus efficient and expensive test. Okay. So and second, diagnosis of cystic sarcosis. So depend on the targeted organ. So CNS to CSF immunology, neuroimaging, the scolics can be seen, okay, and muscles to imaging DX, and eye so imaging, ultrasound and serological examination through ELISA. White cysticercosis is a significant public health issue, so it account for 10% of acute neurological admissions in endemic area. It produced significant livestock production losses to pig owners. An interesting model of zoonotic disease that can be applied to other infection diseases. Okay, so treatment of cysticercosis. Neurocysticercosis is the main problem. The problem of the cyst is the inflammatory reaction. So use of parasiticides or albendazole and dietitious. So aim is to reduce inflammation and scarce tissue. And palliative treatment to control inflammation. So corticosteroids and antihistamines. So treatment of cysticercosis. So surgical removal is required for ocular and superficial cysticercosis, and paraquintal may be used to treat brain cysticercosis, but the patient should take paraquintal in hospital. So prevention: first, health education; second, avoid eating raw bean pulp; and third, avoid pig eating human stool; and fourth, sanitary inspection of excavator and sanitary disposal of night soil. So epidemiology: the disease is prevalent all over the world except Muslim and Zor areas. The infection of Taenia solium is closely associated with the method of pig raising and the sanitary conditions, and affect a million of individuals. So 2.5 million people worldwide carry the Taenia solium, and 20 million are infected with the cysticercosis. Endemic villages. So up to 25% are seropositive and 10 to 18% have CT findings suggestive of neurocysticercosis. How can we prevent cysticercosis? So control the source of infection, control transmission way, educate the population. So avoid eating raw or undercooked pork. Wash hand after using the toilet and before handling food, and wash the peel or raw vegetables and fruit before eating. Okay, and irradiation. So props human is the only carrier. There are relatively simple treatment, and other tissue to technical lack of a simple diagnosis, lack of an easily applicable treatment, and societal poor community cooperation and sanitary education. And third, political. So low periods and DTF birth strategy. Okay. So thank you so much. This session is completed, and any query in mention in comments box. Namaste. Thank you.